Hi, audience. Welcome to Your Health, Your Life. I think today we'll discuss plastic anemia, which probably one may think a plastic, the weight coming from the weight failing to produce something, and of course, anemia, which is low HB. But aplastic anemia is actually beyond low HB because in aplastic anemia, we have two main things. One, the bone marrow is failing, and then ultimately it gives us what's called peripheral cytopenias, where we get to have the HP itself is on the lower side, the platelets are on the lower side, the white cells are on the lower side, which means that even the other things that come to compound or give the true white cell count, which are the differentials, they are also on the lower side. And in these patients, there is no bone marrow fibrosis, and of course, there is no any other abnormal infiltrates in the bone marrow. And then we say this is aplastic anemia. So one would say it's a misnomer. Why name it aplastic anemia when in the actual sense all the cell lines are on the lower side? Well, it's scientifically accepted to be called aplastic anemia, and we understand it as such. So what exactly is this aplastic anemia and how does it present? Um, you get to notice that the presentation is quite wide. Most of the patients will present with recurrent infections uh, because all the cellular elements are on the lower side. The patients who have bleeding tendencies, remember the platelets are on the lower side. They'll have picked symptomatology for anemia, easily getting tired, it's just fatigue, headache, lightheadedness, the heart is beating very fast, and all these other symptomatology. But again, you have to understand that the causes for plastic anemia are vast, and the disease process itself that's leading to that injury, the failure of the bone marrow, can also present with its own symptomatology, compounded with the complication, which is aplastic anemia. So aplastic anemia, in terms of causes, I can say it can be primary, it can be secondary. Okay, so the secondary, I'll talk about the secondary, where it can come as a result of a congenital problem, where maybe there is a gene mutation or a defect in a certain gene, and that then complicates into aplastic anemia. Or it can be due to other substances, secondary causes like exposure to certain agents, radiation. Uh, Talk about there's mining of gold in Zambia, so gold as well got exposure, benzene, okay, arsenic poisoning, and then other drugs. Many of the times we encourage patients not to give themselves drugs. They would rather come to the hospital, then we prescribe the medication, because some NSAIDs themselves, overuse, exposure to NSAIDs can complicate into aplastic anemia. Certain antibiotics, chloramphenicol, sulfonamides, they can also complicate to that. Antiepileptic drugs, some of them like carbamazepine, phenytoin, and others, they're also able to cause that, which is aplastic anemia. Other anti-cancer medication as well, they also fall in the same. It can be treating a thyroid condition, it also complicates into that. So you'd find that when we give medication, that's the more reason we even monitor. We want to know the dosage you're taking, we want to know how you're taking it, so that we are closely monitoring to avoid other complications that may arise. Among these complications is, of course, aplastic anemia. Yeah. Other things could be viral, yeah, viral infections, HIV. It's quite common. It can as well complicate into aplastic anemia where the bone marrow starts fading. Epstein-Barr virus infections can as well lead to that. So in terms of the infections, we have to understand that the infection can be a cause, or infection can come as a complication due to aplastic anemia. Okay, so in terms of the causative agents, there are many that can lead to that. That's the more reason when a patient comes, we want to evaluate this patient. In the evaluation, we want to know exactly what led to this. Okay, so we get to do a number of tests, thinking of can this be as a result of hepatitis, so we screen for that. That is if the history is fitting, and of course we want to see in terms of exposure, could be occupational exposures, or maybe where they're coming from in terms of those that also the painters, they work with glue. Glue vapor itself can as well contribute to that. So we want to know all those other things. That's the more reason when you present to the facility, the hospital, we ask a number of questions because we want to understand the patient, the background, and everything put together, and then we come up with a diagnosis. But the hallmark is that as much as we do the full blood count, all the cellular elements on the lower side, basically hypocellularity, then we want to do the bone marrow. The bone marrow, want to do bone marrow aspiration, and then we get to see how is the cellularity. In aplastic anemia, there is hypocellularity, basically less than 25% hypocellularity. And then we confirm the diagnosis of aplastic anemia. This condition we are able to treat. Of course, we need to identify the trigger, the causative agent. We remove that causative agent so that we help the patient even as much as we treat them. And then the ultimate is, of course, transplant, hematopoietic stem cell transplant, where the bone marrow, where the red blood cells, the white cells, as well as the platelets are manufactured from. And then we also get to give immunosuppressive therapy, and which we are able to do even in our setting. We give a number of drugs, inclusive of the methylprednisolone, in other words, the steroids, the cyclosporins, and thymocyclobuline, um, which is the ATG. We get to give all those things to help a patient, and the patient to recover because we get to treat for the treatment is quite lengthy, and the patients get to recover and do very well actually. Yeah, and the bone marrow gets to its usual state and starts producing the appropriate amounts of the desired elements, white cells, platelets, as well as the HP. Yeah. So basically, that's aplastic anemia. It presents in a very obscure manner, but high index of suspicion in a patient who's having pancytopenia, or in other words, all the cellular elements on the lower side is very much needed in the care of every patient. Yeah. Thank you.